Hi, I'm Dr. Gerard Adler. I'm an orthopedic surgeon and sports medicine specialist. I work at the Aurora Wilkinson Clinic as well as the Aurora Medical Center here at Summit. I'm also the medical leader of our Aurora Sports Medicine Institute here located at our Summit campus. I want to talk today about a patient I had the pleasure of taking care of. Her name is Serena Stinson, and Serena came to me this spring, and she's a 16-year-old individual that had a 5-year history of left hip pain, and her hip was progressively getting more painful for her, and she was finding that as she moved her hip into certain positions, such as flexion and rotation, that it was giving her pain, and she was also noting that she was having popping and clicking in her hip. When she came to me, her pain had really gotten much worse the week prior to her presenting. As I've done hip arthroscopies now for 5 years, which are surgeries done with a surgical telescope, I was concerned that she may have a hip labral tear. We then examined Serena's hip and took x-rays, and she had a bony abnormality within her hip that would create an impingement or pinching between the socket and the ball of the hip joint. And so on this model, that the people sometimes can have an abnormality in a bony overhang of her socket or off of the ball of the hip joint. And the labrum, which is a specialized cartilage O-ring that attaches to the socket, can get pinched between those impinging bony surfaces. So she had developed a labral tear, as well as she had this bony overhang that was called an acetabular pincer lesion. So when Serena would then do certain movements and flex her hip up and rotate, the labrum would get pinched between her joint surfaces. To further evaluate that, because the labrum doesn't show up on x-rays, we got an MRI with contrast, and that showed and did confirm that she did have a labral tear. We then got a CAT scan, because that gives us, and we were able to get three-dimensional images to further map out her bony abnormality. And we also tried a cortisone injection for Serena and have her try to modify her activities. But that's pretty hard for a 16-year-old to really slow down and not do things, which included going to school, also be in gym class, and work in a restaurant. So by the summer, her hip was still painful after the cortisone injection. We wouldn't expect the cortisone to relieve or get rid of a mechanical problem. So we took her to surgery, which was done as an outpatient hip arthroscopy done with a surgical telescope that's about the diameter of a normal pen. And through 2 1/4-inch incisions in Serena's hip, we were able to go in and then remove or resect the bone that was overhanging off of her socket, and then we repaired her labrum. And so that the labrum we repair with 2 bioabsorbable anchors that we're going to dissolve beneath her bone. It takes the labrum then about 3 months for it to heal, so we had to protect Serena for 4 weeks on crutches. Then we were able to have her just do straight ahead things, and so after 6 weeks she was able to do back to pretty normal walking activities. Then by 3 months she was really fully recovered, and she was able to then get back to full activities, including gym and working in the restaurant. And she now is going through her school year, doing things successfully. And at this point, she's really recovered nearly her full motion. Her only complaint is a little bit of tightness that should get better, but she was getting back her hip motion, otherwise her strength, and she got rid of all of her mechanical popping, clicking, and her pain had resolved. So she was really having a great result. And we found that with hip lesions like these, that femoral acetabular impingement can not only cause labral tears, if it goes on through years and years of life, it can cause joint cartilage damage, and is one of the risk factors for premature hip arthritis. So if we have people that develop symptoms early before there's a lot of joint surface damage, which was the case with Serena, if we then go ahead and recontour the bone, which you can do either through big or open surgeries, or you can do the same surgery arthroscopically, you can not only get rid of their hip problem, their pain and mechanical symptoms, but we also may preserve that hip joint and help prevent it from becoming arthritic in the future. So certainly our hope for Serena not only is that she's having an excellent early recovery, but the hope is that she would have a hip that works well for many years in the future.